When you think of a hospital, do you imagine a place of peace and relaxation? If you're like most people, you probably don't. But what if there were ways to modify space to maximize healing?
What's wonderful now is that hospitals are beginning to be designed by healthcare architects to take into account these issues, being aware that the physical environment does affect health. So reducing noise, there are studies showing that simply just by changing the ceiling tiles in the intensive care unit without telling the healthcare providers in that unit that the ceiling tiles were being changed resulted in a significant decrease in the noise levels, an improvement in patient outcomes, again, reduction in pain medication, shorter hospital stays, and, importantly, a better sleep quality in the nurses in that intensive care unit and less nursing turnover. So it's very clear that you can do simple things to the design of hospitals to reduce their stressful physical aspects and improve health outcomes.
That was Esther Sternberg, MD, who will be joining us this week as we start our Mind Body Medicine teleseminar series. She'll be elaborating on the effects space has on healing and our lives. She's at the forefront of a new group of innovators, combining what we know about neuroscience with the real-world application of structural design. Surprisingly, these two seemingly distant groups of professionals are working together, forming the Academy of Neuroscience for Architecture.
Director of Research for the American Institute of Architects, John Eberhard, approached me and said that the book was very architecturally written, and he wanted to know if there was a way to measure people's emotional responses and health responses to built space in order to determine whether the place or space around had an effect on productivity if you're talking about office workers. What he said was when you're talking about productivity, you can measure the number of widgets that people make, but what if the product is a creative product? Is there something that we can measure in the people themselves, in their mind, in their brain, in their body's functions, and their health, to tell us whether the place has an effect on people?
Healing can happen on multiple levels and in multiple settings, not just primary care centers like hospitals. Where we live can have an effect on our health and well-being.
If a patient comes to you and you're a healthcare provider and you say, oh, you have to walk more, don't take your car and walk more, but if there are no sidewalks in your neighborhood, you're not going to walk, you're going to take your car. There are barriers to us exercising as opposed to facilitating exercise, and that leads to obesity, and obesity down the road leads to metabolic syndrome and diabetes. And so in that regard, the people who design and build the places where we live really are our partners in facilitating people's healthy behaviors, because place shapes behaviors that are important in health.
When practitioners know the most up-to-date findings, they can work most effectively to bring healing to their patients. Sternberg covers a lot in this week's call, and this is just a taste. We'll also be discussing what you get when you blend architecture and neuroscience, how to optimize healing in hospitals, how to turn cities into healing spaces. It's free to listen at the time of broadcast, you just have to sign up. Visit www.nicabm.com/mind-body2011 or just click the link below to find out more about this call and other leading teleseminars in mind-body medicine.